Is dealing with patient relations and the radiographer. So this is going to be how we interact with our patients. Okay, so interpersonal skills is what we're going to be talking about, and this is the part where we as your instructors try very hard to teach professionalism and try to set a good role model for you guys to follow so that you have us to watch, and hopefully from us you kind of learn how to interact with patients on a professional manner. It's not only interacting with your patients professionally, but we want to teach you guys how to interact with your coworkers, your boss, and all of that requires good interpersonal skills. And sometimes that requires a whole lot of personal restraint. Anyway, you guys kind of know where I'm going with that. Okay, so communication is a process. It's not an event. Good communication is the backbone of a well-run organization. And like I said, good communication is important with everyone in the office, your coworkers, your boss, your patients, if you're dealing with a rep from a company, all of those things. We kind of set the groundwork for representing our office, not only yourself, but your office. We want patients to feel good there. We want them to feel confident in what we're doing. So our communication skills are very, very important. When we talk about communication skills, I'm not just talking about the words that come out of our mouth. Nonverbal communication can send some serious messages. You guys have probably found that already in interacting with your classmates, in interacting with maybe financial aid, anywhere you go. So nonverbal is a message that's delivered through our posture, through our body movement, through eye contact or lack of eye contact, and our facial expression. Facial expression today is hard to tell because we all wear masks. So sometimes it's hard to tell. I can usually tell by looking in someone's eyes, though, kind of where they're going or how they're feeling. You can read a lot about a person through their eyes. So we need to bear this in mind when we're talking to each other, when we're interacting with a patient. Do I have my arms crossed? Do I have my back to the patient when I'm asking questions that are maybe important? Maybe that patient's had cancer and I'm trying to find out details and I'm not giving them any eye contact at all. I've got my back to them. I like to try to interview my patient with their health history in my hand, face to face, make notes on their health history, and then go to my computer rather than standing with my back to them the whole time. It makes the patient feel like you care. Verbal communication is selecting appropriate word choices and the delivery of those words. So I talk to you guys a lot about this. We'll talk about it especially in anesthesia. We don't want to use scary words or intimidating words when we're discussing our treatment with our patients. So we're not scraping their teeth. We're not digging in their gums. We're scaling. We're removing deposit. When we talk about giving an injection, I never use the word needle. I never use the word stick or poke. We try to use kinder words. A lot of times you'll hear me say, because there's two different lengths of needles that we use. So I will call those tips. I will not call them needles. I'll say injection rather than poke or stick. Withdraw. I just try to use words that are not as threatening. So be thinking about that when you're working with patients. And make sure that when you ask a patient a question, and I will challenge you guys to do this with each other as well and with your instructors. Being a good listener is probably one of the hardest jobs I've had to try to master, and by no means am I a master. Every single day I work so hard at this because we as hygienists are all type A, and we all want to be heard, and we all think we know the right way. So you can imagine what it's like when all of your instructors and Director Beckerly and Dr. Thurlow are all in a meeting. We all want to be heard. So sometimes it's really hard for us to be the best listener because we want to be heard and we tend to talk over each other. But we all know it and we love each other anyway. But being a good listener is actively, you're going to ask a patient a question, and then you need to sit back and listen and close our lips and listen to the answer to the question. You can find out a lot about a patient just by giving them the opportunity to talk and be heard. So I will encourage you guys to try to be really good listeners when you're doing health histories. I cannot tell you how many times, and it happened to me in private practice, I'll come over, go over the health history that you have just gone over with your patient, and I will get 2 times the information you did because of the way I ask the questions, because I'm not scared or intimidated. I will ask probing questions that you maybe are afraid to ask. So that's why I'm saying watch your instructors, watch what we do. As you become more confident in working with patients, you'll be the same way. You'll be able to do it just like we do. Okay. Facilitation skills. This is where we ease communication and develop a trusting relationship between you and your patient. You're the professional and your patient. And this is what I was just talking about. You want to encourage questions from your patient. So if a patient says to you, well, I've kind of been having some stomach issues, you might say, well, tell me a little bit more about that. Are you on any medications for that? Is it GERD? Is it, you can start asking them questions and then answer their questions. If they ask you something, and if you don't have the answer, tell them that you will find the answer. As a patient that has been through many medical issues over the course of the last 10 years of my life, I appreciate it so much when somebody can actually, first of all, tell me if you don't know the answer, but then follow through and find the answer for me. So answer their questions, respond with action, express warmth, which is also known as empathy. The patient should feel like they're being cared for. You don't have to feel sorry for them, but you want to empathize with them and understand why they might be feeling the way they're feeling, those kinds of things. The relationship between the patient and the dental professional is based on a few things. As you guys know, first impressions are key. Let's say that you, which I had a student yesterday, had a flat tire on the way to school, came in. Luckily, her peer took her patient, so she didn't have to deal with it. But let's just say that you're on your way to work, you've got a flat tire, your kids missed the bus, your whole day was just nothing but a hot nightmare in the beginning, and you get to work and you're all flustered, and you walk out and you bring your patient back, and they can sense that. So somehow we have to separate our bad day, or we're feeling bad, or we're mad at our husband, or we're mad at our wives, or whatever, and come out with a smile on our face and realize that everything that's happening in our life has nothing to do with that patient, and nor should they feel it today. We want to give them what they've come for, and they deserve to have the best care that we can give them. So first impressions are important. Chairside manner is important, and that's what I was talking about with nonverbal. Give your patient eye contact. Face them. Be open to them. Don't stand there with your arms crossed like you don't care about what they have to say. Attitude. If a patient is a difficult patient, I have found that if I get frustrated and kind of short, which we've all done, that patient is going to act out even more for me, and it's going to be worse. But if I kill them with kindness, by the end of the appointment, they love me, and I usually have developed a love for them as well. So just back to the first impression, some of the things that we try to hit on with you guys. Come in well groomed. Don't come in with last night's, one day we had a hygienist come in, a student, and she had black all under her eyes from her mascara. And she'd obviously had a rough night the night before, been out too late. I think she'd had too much fun, and her peers were even teasing her. And so you don't want to come in, like, she wasn't coming in to see a patient, but it's still, you want to approach each day in the best way, be the best you can be that day. So make sure you're well groomed and your scrubs are not, they don't look like you pulled them out of the laundry basket and they're a wrinkled mess and all of those things. Because think of yourself sitting in that waiting room. If somebody comes out to get you, to bring you back to clean your teeth, and let's just say that they have horrible breath and their scrubs are all wrinkled and messy and they don't smell clean, you're not going to be excited about that person working on you, or I wouldn't. So we want to be well groomed, have good personal hygiene, properly greet the patient in the reception area. I cannot stress this enough. Use the proper title. And when I say that, if you're bringing a patient back that is older than you, always use Mr. or Mrs. or Ms. There are a lot of older patients that are very offended if you come out and call them by their first name. We had one in our office that would only see me because I called him Mr., and the other ones would all call him by his first name. His first name was Charles, and the biggest mistake that was made was one of the hygienists went out and called him by Chuck. This man was 80 years old. He was a reputable lawyer in the area. He was incredibly offended by that. So just always remember, until they tell you differently, properly greet the patient. And even with HIPAA today, it's probably best just to, if it's a young person, obviously we're probably just going to use their first name. But if it's an older person, I would just say Mrs. Smith until they tell you differently. You always want to introduce yourself, and we prefer that you guys do not use your last name so that patients don't know your last name. You just say your first name. But always introduce them, introduce yourself, and let them know that you're the hygienist that's going to be taking care of them today. As far as chairside manner, we're just talking about the way you interact and conduct yourself chairside while you're working with the patient. We want to try to have a relaxing effect on our patient. Be confident. We always say fake it till you make it. Even if you don't know what you're doing, you never make comments like that in front of your patient. I've had a couple of students that sweetest people, but they would be right in front of the patient and say, oh my gosh, I don't even know what I'm doing. I don't even remember how to do that. Okay, if you're gonna do that, step to the back, pull one of us over and tell us that at a separate computer. Don't say that in front of your patient. Just say, I'll be right back. I'm gonna go talk with my professor about something or something like that. But you always want to come off confident in front of your patient. Avoid those statements that will indicate a lack of control or professionalism on your part, because we want you to maintain that positive rapport with your patient. Attitude is the last thing we touched on. And again, this can be nonverbal by the position of our body, or how we carry ourselves can be indicative of our mood. We want to be polite and courteous towards our patient at all times, even when they're not. And I will tell you, this only goes to a certain point. I want you to know that if you ever have a patient in your chair that is making inappropriate comments, and I'm not saying this can't happen to our male students, but it happens more to our female students. And there have been a couple of instances, not many, but there have been a couple of instances where we have had to step in and nip that in the bud. If you have any patient that is stating anything to you that's inappropriate, you have the right to say, that's not an appropriate conversation for us to be having. And if they continue, then you come get one of us and we have no problems handling that. So when I say be courteous and polite, there are limitations on that. Professional courtesy, patience, and honesty. Some procedures are uncomfortable. Don't lie to your patient and say they're not going to be. Radiography is one of them. We never ever want to bring up the word gag or even insinuate that that could possibly happen, because then you're putting the thought there and the chances are greater that they will. So if a patient would say to you, you know, I've had x-rays in the past, they're horrible, they hurt. We're just going to say, yeah, it's a mouthful, but we've got lots of little tricks of the trade that I can try if we need to, and I can be really, really quick. And if you work with me, I'll work with you, and we'll have this done before you know it. So I'm not telling them that it's not going to hurt. but I'm telling them that I'm experienced, I'm confident, we can do this together, and if one way doesn't work, I've got other options. So, and the same will happen, like when you're given an injection, people are going to say, you know, they're going to be petrified. A lot of them are petrified of having injections. Some of you are probably petrified, but we will teach you techniques, will help you understand why some of those injections have hurt. A lot of it is technique. So we will do our best to calm our patients, make them comfortable, and let them know they can trust us. We're not going to lie to them. All right, that is